Bismillahirrahmanirrahim. My name is Dr. Rizwan Gohar, and today's talk will be on the topic of care of a newborn baby. There are certain learning objectives for today's talk. The first one is to know about the basic steps of newborn care. The second learning objective is important clinical issues involved in the care of a newborn baby. So, newborn is a baby who is up to first 28 days of life, and after 28 days of life up to 1 year we call it infant. So, newborns may look alike in their physical appearance, but there are individual variations among the newborns present as well. Similarly, there can be full-term newborn and there can be preterm newborn babies. Full-term mean that a baby who is delivered on 37 full weeks of gestation or above that. And a preterm baby is a baby who is born below 37 weeks of gestation. There can be individual variations amongst the newborns in perspective of the race, genetics, and various nutrition factors that come into account during the whole pregnancy. If we talk about the weight of a full-term newborn baby, that is variable and that varies from 2.5 to 3.9 kg. So, if a baby who is having more weight above 3.9 kg, the baby is called large for gestational age or LGA baby. During the first couple of days up to first 10 days of life, there may not be a weight gain in newborn baby. Reason for that is that when the baby is born, the baby is edematous, he is retaining fluids, meconium, and various other things, and all these things are lost via a urine and by the passage of meconium. So there may not be weight gain during the first week or up to 10 days of life. After that, baby starts gaining weight gradually. The average weight gain of a newborn baby is up to 30 grams per day. So this is the average gain of a newborn baby if the feeding is optimal. If we talk about the length of a newborn baby, the length of newborn baby is around, on an average, is 50 centimeter at the time of birth, and at the age of 1 year, this length increases to 75 centimeter. And head size, the head circumference or occipitofrontal circumference (OFC), the head circumference at the time of birth is between 33 to 37 centimeter. Likewise, the chest circumference is almost 2 centimeter less than head circumference. Suppose a newborn baby is having a head circumference of 35 centimeter, the chest circumference would be around 33 centimeter. The peripheries of a newborn baby, they may not be pinkish at the time of birth due to poor peripheral perfusion and poor circulation and hypothermia. So this condition is called acrocyanosis. With the passage of time, after a couple of hours, the peripheries they become pink in color and the bluish discoloration disappears. Baby right at the time of birth is covered with a waxy material or fatty material which is called vernix caseosa. This liquid covers this is a thick liquid that covers all of the head, face, chest, abdomen, and limbs uh, with a certain material that is basically insulating in nature. It prevents evaporation and heat loss from a newborn baby, and thus it has an important role in prevention of hypothermia in newborn baby, because hypothermia can be a troublesome condition in newborn babies. You can see a newborn baby who is extensively covered by a fatty cheese-like material that is called vernix caseosa. So this material should not be removed from the baby because it is protective in nature. It prevents heat losses, it prevents evaporation, and it also acts a physical barrier against different infections that can invade the skin of a newborn baby. Likewise, we have to examine the external auditory canal. Is there any problem with that or not? We have to examine the eyes and breast and abdominal examination for any mass, for any organomegaly at the time of birth. The trunk is relatively larger and extremities are short in newborn baby. There can be mild hepatomegaly. Liver may be palpable 1 to 2 centimeter in newborn, and tip of spleen may be palpable. Similarly, lower poles of kidneys may be palpable in newborn. We have to examine the scrotum in male babies. We have to palpate the testes. Similarly, female external genital examination is also mandatory. We have already talked about the weight, length, head circumference, and chest circumference in newborn babies. This is the method that how do we take head circumference in a newborn baby. You may get this command in your short case examination, that how do we take head circumference at different ages, and you should be knowing the normal values of head size at different ages. Vital signs in newborn babies. From this slide you can see what should be the temperature of a newborn baby, what should be the optimal heart rate, what should be the respiration. It should be less than 60 per minute. However, right immediately after birth there can be increase in respiratory rate. You can also see the blood pressure variation in the newborn babies. The color of newborn baby, that baby is having acrocyanosis during first 30 minutes of life. The temperature within the first 15 to 30 minutes after birth falls because the baby has come from a very protected intrauterine environment to extrauterine environment. There he is facing different stresses, cold, convection, radiation, evaporation. So he has to stabilize his body temperature. So stabilization may need some of the help, that we should be able to prevent the evaporation. We should be covering the baby. We should not be removing the protective material vernix caseosa, and we should be putting the newborn baby on a radiant warmer to prevent heat losses by different forms. Here you can see a picture of a newborn baby with blue peripheries, the condition that is called acrocyanosis. The respiration of a newborn baby may be irregular in the first few minutes of life, and later on they become regular, and respiratory rate, however, should be less than 60 breaths per minute. Sleep of a newborn baby is around 16 to 18 hours a day. The energy requirement is almost 120 kilocalories per kg per day. There are two important definitions: early neonatal period and late neonatal period. Early neonatal period is called during the first 7 days of life, and late neonatal period is called right from the seventh day of life up to 28 days of life. A healthy newborn baby develops spontaneous respiration and crying immediately after the birth. However, if there is some problem like birth asphyxia or hypoxia to the newborn baby, that may be in utero, right at the time of birth or after the birth, the baby may need help in the form of external stimulation. There may be need for maintaining airway, breathing, circulation, um, a full algorithm that is called newborn resuscitation, and there are sequence of steps to follow to help such babies breathe, those who are not crying due to some hypoxia or due to some birth related injury. So, right at the time of birth, we should be examining the newborn baby for any congenital malformation, or any dysmorphism, or any abnormal features that may impact the quality of life in these newborn babies. This condition is called acrocyania. Here you can see there is absent head, the brain tissue is minimal, and a proper well-formed head is not present. So this condition has implication in the form of mental retardation, fits, and multiple issues due to absent brain tissue and absent cranial wall. Another a common example of congenital problem syndrome that is called Down syndrome. Here you can see the newborn with prominent medial apicanthal folds, prominent and protuberant tongue. So this is a newborn with Down syndrome. Another example of congenital malformation in the form of cleft lip and cleft palate is visible in this picture. Here you can see a large swelling at the lumbosacral area. This is the protrusion of meninges as well as spinal cord from the vertebral arches. Because there is some defect in the formation of vertebral arches, that leads to protrusion of meninges as well as spinal cord. This condition is called meningomyelocele, and it has a long-term implication in the health of a newborn baby. The initial assessment of a newborn is very important. The most essential assessment is the first cry of a newborn baby. The first cry means that baby is active, he or she is breathing well, he has a good heart rate, has a good respiration, and as a result of good respiration, good heart rate, the color will also turn from cyanotic to pinkish color as well. So all the vital signs, they also will be preserved with a good first cry. So this was named uh, This APGAR scoring is a scoring system to depict the outcome of a newborn baby and uh, to see the effectiveness of newborn resuscitation. So this was named after the name of a doctor, Dr. Virginia APGAR. So what is basically an APGAR score? APGAR score, here you can see APGAR mean A for appearance, like skin color, P for pulse or heart rate, C for cardiac activity, sorry, A for appearance or skin color, P for pulse, G for grimace, like feeling of uneasiness on the face, that is called grimace. A for sorry, uh, there is some problem with the. All right. A for appearance, P for pulse rate or heart rate, G for grimace. Here you can see the reflex response, and A for activity or muscle tone. What is the movement of the newborn baby? And R for respiration. So different numbers are given starting from 0 to 2. So if respiration is absent, we give a 0 number. If there is good crying, good respiratory effort, we give 2 number. Likewise, we categorize the newborn baby according to this APGAR scoring. And at the end, we add all these numbers. So total numbers, these are 5 different parameters. So total numbers will be 10. So if a newborn baby who has a score of 7, between 7 to 10, then there is no depression, means there is no birth asphyxia and baby is active and healthy. So if the APGAR score varies between 4 to 6 out of total 10 numbers, then there is some mild hypoxia. And if the APGAR score is between 0 to 3, that shows severe birth asphyxia. So this APGAR score is taken right at first minute of life, 5 minutes, then 10 minutes, and then it may be extended up to 20 minutes. This assessment should be done in a comfortable, warm room with a good light. So, a newborn has to be examined right from head to the toe, including the examination of face, mouth, oral cavity, palate, examination of the chest, auscultation of the heart for any added sounds, murmurs. Similarly, abdominal examination, examination of the anus. So at times there can be imperforate anus. We may miss the examination of anal opening, and ultimately the newborn may come after a couple of days with abdominal distension and in a difficult condition to manage. So this anal examination should be right there at the time of birth. Similarly, examination of the genitalia is very important. If we miss ambiguous genitalia or sex demarcation is difficult at times due to ambiguous genitalia or congenital adrenal hyperplasia. So in that condition, if we miss that and if we do not manage that condition, the newborn baby may come across in the condition of shock due to Addison disease, due to underlying congenital adrenal hyperplasia. So genital examination is mandatory. So a newborn baby undergoes profound changes at the time of birth. So he comes out from a very protected in utero environment to the external environment and stresses. So proper nursing care, a proper care by the mother and the caregiver should be given to prevent any complication in newborn. Around 80% of the newborn babies they require only minimal care. There are only a few percent of the newborn baby who need some assistance. So, if a baby who is not well, who is not crying, and who is having poor respiration at the time of birth, he may need help in the form of clearing the airway and wiping out the secretion from the nose and the mouth of the newborn baby to establish the first breath and to establish a proper respiration. So this is a method of maintaining the airway in newborn baby. The figure on my left side, you can see with the yellow line that a newborn baby, the airway of a newborn baby should be maintained with the slight extension of the head. So this will maintain the maximum potency of the airway to conduct air from the outer environment inside of lungs. So the potency of the airway will be maximum in this way. So this is how do we maintain the airway. And second, the figure on my right side is you can see the use of a blue bulb sucker to take out the secretions from the nose and from the oral cavity to provide a patent and clear airway. So we do the suction from the mouth and then from the nose. The cry of a newborn baby is very important. So if you find a newborn baby who is having a very high pitched cry, then it may indicate some underlying significant condition or pathology. So similarly, weak cry is a sign of premature baby. Similarly, a baby who is having a hoarse cry, that can be due to some laryngeal obstruction. Maintaining the temperature and providing the warmth to the newborn baby is of paramount importance. If a baby who is just delivered comes to outer environment and gets hypothermic, so hypothermia is a major killer, and in the presence of hypothermia or the metabolic pathway of the bodies they slow down, and the outcome of a baby with hypothermia may not be so good. So important thing is to provide the warmth to newborn baby, and this is provided first. We make ready a radiant warmer to receive the baby, to provide a good temperature over that, and we provide a kangaroo care. Kangaroo care is a skin to skin contact. uh, the baby who is just delivered should be immediately attached to the chest of the mother, and both should be wrapped in a way uh, like the kangaroo does. So this provides optimal temperature from the body of the mother to the newborn and to prevent hypothermia. This is the basic concept behind the kangaroo care. Here you can see on the left side a mother uh, and a newborn baby. Newborn baby is just delivered, and you can see the vernix caseosa over the body of the newborn, and baby is attached to the chest of the mother to prevent uh, hypothermia. Similarly, father on the right side is also trying to learn kangaroo care with his twin babies. So in case if mother is unwell, is not available due to some complication, so this job can also be done by the father. Skin care in newborns is very important. We should wipe off the blood, the secretions, and mucus, meconium, before presenting baby to the mother. So again, I would emphasize that no one should make vigorous efforts to remove the vernix caseosa. Umbilical cord. So this umbilical cord normally falls after 5th to 10th day of life, but it may take some couple of more days in newborn babies. The care of newborn umbilical cord is very important, and we should be applying some antiseptic solution on it, and hygiene should be maintained. So here is how do we cut the umbilical cord after birth, and clamping is done around 2 centimeter from the skin of the newborn baby. Care of eyes. Eyes should be cleaned at the time of birth and once daily with sterile cotton. And each eye should be cleaned using a separate swab. If at some stage or couple of days of birth we find there is redness of eyes or there is stickiness of the eyes or discharge from the eyes, this may need prompt management because these are signs of neonatal conjunctivitis, which is also called ophthalmia neonatorum. Here you can see the picture of a newborn baby with extensive purulent discharge from the both eyes. So immediately culture sensitivity of this pus should be sent. It can be chlamydia, it can be gonorrhea, or it can be some other microorganism. So culture sensitivity should be immediately sent, and we have to start the empirical treatment for the management of ophthalmia neonatorum. Vitamin K administration is very important immediately after the birth. The dose is between zero point 0.5 to 1 mg. This vitamin K should be given to all the newborn babies intramuscularly, and it prevents hemorrhagic disease of newborn babies. The reason behind that is newborns, they are deficient in the synthesis of vitamin K, which is being uh, synthesized by intestinal flora in healthy children. But the flora of newborn babies or infants is not ready enough to make vitamin K. So deficiency of vitamin K can lead to deficiency of certain clotting factors like 2, 7, 9, 10. So if there is deficiency of certain clotting factors, that can lead to significant hemorrhage in newborn babies. Likewise, the children or newborn babies who are on mother feed is also deficient in vitamin K. So that is very important to give vitamin K immediately at the time of birth. Important vaccination to be given at the time of birth or BCG vaccine to protect against tuberculosis, hepatitis B vaccination, and polio vaccine. These all should be administered after the birth. The baby should be put on mother feed immediately after the birth, preferably within first 30 minutes of life. The first milk, which is also called colostrum, is very rich in immunoglobulins that provide protection to newborn baby against different invading microorganisms, viruses, and bacteria. So, mother feed should be established immediately after the birth to provide good level of immunity to the newborn babies. Mother is feeding a newborn baby. Very important step to prevent infection in newborn baby is meticulous hand washing and maintaining the hygiene of the caregiver as well as of the baby. So the most important reason for spreading infection in newborn baby is our hands. So if hands are clear, they are well washed, the newborns, they are protected against different type of infections. The babies should be lying posture, that should be supine. So in this condition, the chances of sudden infant death syndrome, they are minimal. However, if a baby who is put to sleep on a prone position with face downward, there are very high chances of getting sudden infant death syndrome. So the lesson is that baby should be lying supine with the face facing upward. When there should be regular visits of the newborn babies, so it is mentioned that there should be at least once every month visit for the first 3 months of life to check the development, to check the growth parameters of the newborn babies. And after that, there should be every there should be visit after every third month up till the age of 1 year. Thank you very much. If there are any queries, you can put your question on the forum, or you can send your queries to me. I'll be more than happy to answer that. Wish you all the best. Thank you.